Hello, YouTube! We are back with another exciting video topic. Today's topic was inspired by my unemployment as a nurse, and ironically, this month we have Nurses Week. Welcome to the Rapid Nurse channel. Who am I? I'm just a nurse with years of experience making me a nurse of all trades, but a master of nothing. These rapid experiences in the healthcare field took a young, fresh-faced nurse with boundless hopes for our healthcare and twisted it into a tired old nurse with a jaded sense of humor. On the channel, we will discuss topics that affect our healthcare. Before we start up the video, please take a moment to hear from our friends at Fiverr. I've been searching for a way to boost my YouTube presence, and I think I've found the perfect solution. Fiverr. It's my one-stop shop for all my freelance needs.
Tired of juggling multiple freelancers and sites? Want to streamline your business and save time? Fiverr is the answer.
I've already hired a graphic designer to create a new logo and a social media manager to handle my content. And guess what? I found them all on Fiverr. CT match for any project, big or small. Becky.
With Fiverr's vast network of talented freelancers, you can find the perfect match for any project, big or small.
The platform is so easy to use. I simply posted my project, set my budget, and received dozens of proposals within hours. It's incredible. Here at Rapid Nurse, we work with the talented freelancers of Fiverr to create this very YouTube video you are watching.
Join the millions of satisfied customers like Rapid Nurse who have discovered the power of Fiverr. Start your next project today and see the difference by clicking on the link below to help the Rapid Nurse channel.
So what are you waiting for? Visit Fiverr today and start collaborating with amazing freelancers from around the world.
Fiverr, your freelance marketplace, your business success. Now back to your video.
Sorry, we are short-staffed today. Over the past few years, healthcare systems across North America have faced a staffing crisis that seems to have no end in sight. While it is easy to blame the pandemic for worsening the situation, the reality is that this problem has been brewing for decades. From delayed treatments to burnt-out staff, the impact is pervasive. But why is this happening? Is it solely a lack of workers, or is something larger at play? Today, we will explore why healthcare facilities are so short-staffed, how this situation has evolved, and what the future might look like if changes are not made. To understand why healthcare staffing is such a mess, we have to look beyond recent events and dig into some long-standing issues. One of the biggest factors contributing to short staffing is a persistent shortage of qualified healthcare workers. This shortage didn't start with the pandemic. It's been building for years due to a combination of factors. If you know of some factors, put it in the comments section. I will reply to you. One of the biggest drivers of short staffing in healthcare is a problem hiding in plain sight: an aging workforce. In North America, a large percentage of registered nurses, physicians, lab technicians, and other healthcare professionals are rapidly approaching retirement age. According to a report by the American Association of Colleges of Nursing, AACN, the average age of registered nurses is now over 50, and the trend is similar for physicians, many of whom are in their 60s or even 70s. But it's not just about the numbers, it's about the experience they take with them. These seasoned professionals have decades of hands-on knowledge, mentorship skills, and the ability to handle complex situations calmly. When they retire, they leave behind a void that cannot be easily filled by fresh graduates. And here's where the real problem begins. For every experienced healthcare worker who retires, fewer younger professionals are stepping in to take their place. I don't blame younger people for not wanting to go into nursing. What is their incentive? This is partly because healthcare education is a long, expensive, and challenging journey. Normally, the nursing program here in Canada is 4 years. Medical and nursing schools are highly competitive, and the training process, often taking years, can be a deterrent for many young people. Even those who do graduate face a slow transition into the workforce, dealing with licensing exams, residency programs, and the stress of adjusting to real-world healthcare. As these older professionals leave, healthcare facilities find themselves struggling with a knowledge gap and a shrinking workforce. This is not a future problem, it is happening right now. And as the aging population continues to grow, the demand for healthcare services will increase, creating even more pressure on an already strained system. But an aging workforce is only the beginning. Another critical issue making things worse is the lack of effective training pathways for new healthcare workers. Becoming a healthcare professional is not just about passion. It's a long, expensive, and competitive journey. From medical schools with limited seats to the grueling residency programs that follow, the path to becoming a doctor, nurse, or other healthcare provider is filled with barriers. In North America, medical schools and nursing programs are struggling to keep up with demand. According to the Association of American Medical Colleges, AAMC, the United States could face a shortage of up to 124,000 physicians by 2034. But why is this happening? Part of the problem is that while demand for healthcare workers is skyrocketing, the capacity of training institutions has not kept pace. Universities and colleges have limited resources, meaning they can only accept a certain number of students each year while trying to maximize their profits. Even those who get in are not guaranteed a smooth path to a career. Many graduates face a bottleneck when it comes to residency programs, where the number of available positions is often far lower than the number of qualified applicants. This means that talented, motivated medical graduates may find themselves unable to complete their training, left waiting, or forced to pursue careers in other fields. The situation is even worse in rural areas. Here, healthcare facilities struggle to attract and retain trained professionals, a problem made worse by the isolation and lack of support that recruits often experience. On a personal note, I have found that there is nursing work. It's just that you have to go where no one wants to go. One rural healthcare facility director described it as a revolving door. New hires arrive, but the stress and loneliness push them out almost as quickly. It's like management created short staffing issues facing us. Training isn't just about teaching medical skills, it's about preparing professionals for the realities of healthcare work. But with limited seats, long pathways, and insufficient support, many potential healthcare workers are lost before they even begin. But what about those who do make it through the training? What are they facing once they enter the workforce? This brings us to a problem that has become impossible to ignore: working conditions and burnout. If there is one thing the pandemic exposed, it's how intense and unforgiving the healthcare work environment can be. Healthcare professionals are no strangers to long shifts, emotional strain, and constant exposure to illness. But when COVID-19 hit, these challenges exploded. Suddenly, nurses, doctors, and support staff were working in overcrowded hospitals, dealing with critically ill patients day after day. Personal protective equipment like the N95 mask was in short supply, and the constant fear of bringing the virus home to their families was an ever-present shadow. During this chaos, many healthcare workers felt isolated, overwhelmed, and mentally drained. Then add government overreach demanding healthcare employees get the vaccination or else. As a nurse, I have always believed people's health is the matter of the people making informed choices. A survey by the National Academy of Medicine found that up to 54% of healthcare workers reported experiencing burnout. But what does burnout look like? It's more than just feeling tired. Burnout is a state of emotional exhaustion where professionals begin to lose their sense of personal accomplishment and become detached from their work. It affects their mental and physical health, their relationships, and even their ability to provide quality care. The problem is not just about dealing with sick patients, it's about the constant pressure to do more with less. Then, management pockets the difference, then blames staff for the quality of their work. Healthcare workers are often asked to handle impossible workloads, care for more patients than they can safely manage, and make life or death decisions in split seconds. For many, it's simply too much to bear. For example, I was in a scary situation where I was responsible for 90 patients. Some have responded by reducing their working hours. Others have left the profession entirely, seeking careers in lower stress industries. And those who remain are left picking up the pieces, struggling to maintain their well-being while caring for others. But there is another factor making this problem even worse, one that is often overlooked until it is too late: wage disparities and job dissatisfaction. While healthcare is often seen as a noble profession, the reality is that many workers feel they are not being fairly compensated for the risks, responsibilities, and sacrifices their jobs demand. This isn't just about money, it's about feeling valued, respected, and supported. When family members see what us healthcare professionals do with their family members or to the other patients in the room saying, "I don't know how you do it." And right now, many healthcare workers feel anything but valued. It was the feeling of being treated like property that motivated me to create Rapid Nurse, an outlet to have my voice heard after being told to shut up and know your place by weak management who only cared about their bonuses and profits. For physicians in specialized fields, high salaries are common. But for nurses, nursing assistants, support staff, and even primary care doctors, the picture is very different. According to a report from the Bureau of Labor Statistics, the wages for many frontline healthcare workers have not kept pace with inflation, rising living costs, or the immense pressure they face every day. Nursing assistants, for example, perform physically demanding work, lifting patients, managing hygiene, and providing emotional support, all for wages that are often close to the minimum. My mother is a care aide and reports often she is underpaid for the hard and exhausting care she provides for care people's loved ones. When other industries, such as retail or technology, can offer similar or even higher pay without the physical and emotional strain, the choice for many becomes clear. The dissatisfaction doesn't end with pay. Many healthcare workers are also frustrated by poor benefits, lack of paid leave, and limited career advancement opportunities. Nurses who have worked for decades may find themselves earning only slightly more than fresh graduates, while opportunities for further training or promotions are scarce. It is so true. Due to job insecurities, I had to accept pay that was of a grad nurse, even though I told management I was already a nurse with a valid license, therefore legally I should have been paid as one. Their response was, "Sorry, it's not in the budget," and finally, "If you don't like it, quit." This sense of being undervalued is a powerful force driving workers out of healthcare. It's a feeling reinforced every time a worker pulls a double shift because of staffing shortages, or when they receive a paycheck that seems out of touch with the realities of their job. For some, the choice is clear. Why endure the stress and risk of healthcare when other industries offer better pay, better hours, and better treatment? But wages are not the only problem. Even in facilities that pay well, workers often face another challenge that is driving them out of the profession: poor management decisions and a lack of support. If there's one factor that can make or break a healthcare facility's ability to retain staff, it's the quality of management. But all too often, healthcare workers find themselves facing decisions made by administrators who are more focused on budgets and bonuses than on patient care or staff well-being. To cut costs, many hospitals and clinics have implemented hiring freezes, reduced staff numbers, and pushed remaining workers to take on heavier workloads. This is about being overwhelmed, forced to care for more patients than one person can safely manage, and doing so without the necessary support. Efficiency is a popular buzzword in healthcare management, but what it often means in practice is that fewer workers are expected to handle more tasks. Ever wonder why it takes forever for the nurse to answer the call bell? It's because there are other patients we are looking after and not enough staff hired. In some cases, nurses are asked to oversee not just patient care, but also administrative duties, which means less time for direct care and more stress. During the pandemic, these management failures became painfully clear. Hospitals scrambled to secure protective equipment, but many workers reported being forced to reuse masks or work without adequate protection. The main reason why we were told we couldn't have N95 masks was because they are too expensive. Those who raised concerns were often ignored, dismissed, or even threatened with disciplinary action. The message was clear: protecting profits was more important than protecting people. The disconnect between management and frontline workers can be devastating. Many healthcare professionals describe feeling like they are treated as replaceable, expected to work in unsafe conditions, accept low pay, and never complain. But the truth is, they are not replaceable. When an experienced nurse, doctor, or technician leaves, their knowledge and skills go with them, creating a gap that cannot be easily filled. Policies focused on saving money in the short term are costing healthcare systems far more in the long run through high turnover, poor patient outcomes, and a reputation that drives new talent away. But understanding the causes of this crisis is only the beginning. The real question is, can it be fixed? If you were in charge of fixing the healthcare staffing crisis, what would be the first thing you would change? Let us know in the comments below. If you found this video interesting, don't forget to give it a thumbs up, subscribe to our channel for more thought-provoking content, and hit that notification bell so you never miss an update. Thanks for watching, and we'll see you in the next video. I find it interesting as time goes on and as healthcare rapidly changes in 2025, you took the time to view the video. You have my sincere gratitude, thank you. Could you do me a favor for Nurses Week by thanking a nurse for what they do? It does make a difference in a nurse's life. Before I sign out, could I ask you to please like, comment, turn on notifications, and subscribe to Rapid Nurse? This will really help the channel get medically cleared and back out on the front lines. Until the next Rapid Nurse video, take care of yourselves and each other.